Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes, and today we're talking about going to the dentist. Dr. Vince Powell is with us to talk about that today. When's the right time to start going to the dentist, and how often should we all be going?
All right. Well, first of all, thank you for having me. The American Dental Association recommends that 6 months is a great timeline. And if you've established care with someone already, then sometimes you have a little bit more leeway. If you have shown and proven to have no risk caries and you don't have any systemic disorders, and sometimes you can stretch that out to a year. But their general rule of thumb is 6 months you want to get in and see your dentist just to keep things checked out.
Get those 6-month cleanings,
Right.
Make sure everything
Absolutely.
is good to go.
Yeah.
Okay, so that's for general. When you have children, when should you start taking them to the dentist?
Right. Well, the American Academy of Pediatric Dentistry says 6 months after their first tooth erupts, and oftentimes that comes at first birthday. So that's a good general rule of thumb, is first birthday, and it may seem early, but it's really good to get a kid in there to familiarize themselves with the dentist. Parents know when they come in often, they say, I was so scared of the dentist and I've avoided it for so many years. And it has so many negative effects. So as a parent, the best thing you can do is to get your kid in there early, as the first birthday, and then start from there, and they'll grow a relationship with the dentist and grow familiarity and comfort with that. And not only that, but we can just see what's going on early. Not a lot's going on that early, but we can make sure that there's nothing.
But just getting everybody used to the chair and the lights and
Absolutely.
having someone, touch their mouth.
Right, absolutely.
It's a big deal about having your child have a positive experience with the dentist. The earlier the better.
Right, and we have some young kids, and we get in there together. It's really teamwork with the parent. We're on the same team. There's no judgment. Lots of parents feel like they're going to come in and it's, they're going to judge how good a parent I am. They're going to judge my brushing of this kid, and it's not like that at all. We're on the same team, and so get them in there, and we'll look at it together. If you have questions, we'll look at it together. Oftentimes, when it's that young at age 1, you're holding that child. And I'm holding that child with you. We're there together. So they're not leaving your arms, and they grow a real comfort, and it's a lot easier than you might think.
Yeah, a nice positive start too, that way. Let's talk about services Valley Health provides for dentistry.
Yeah, we offer a pretty broad scope. Of course, we have several locations, but each location is they don't do things incredibly differently, but each location is kind of tailored for certain things. We're not all outfitted with things for dentures. Okay, so some of our locations do fewer dentures, but in terms of the bread and butter, okay, what I mean by bread and butter is what do all of us offer? Okay, every Valley Health location is going to offer hygiene, getting your teeth cleaned. Okay, they're going to offer dental exams. Okay, that's the basics. Fillings, fixing teeth, of course. Most offices will pull just about any tooth, and we all have our limitations there, and it's important to understand when the best outcome for a patient might not be with us. It might be with an oral surgeon. It might not be with us. If a child needs extensive care, sometimes it might not be best outcome with us. Maybe we need to get you in the chair with a pediatric dentist, but we offer all those services. And then above that, people often ask about crowns or caps, some people call them, or bridges and dentures and implants even. And we offer implants. We'll plan that process with you. So broad scope. And so we'd be come. The best thing to do is come and ask us. Is this the right place for me? We can tell you what we can offer you, and most of the time the answer is going to be, yeah, we can do something for you.
From cleaning to crowns, that's a wide spectrum.
That's right. Absolutely,
for sure.
yeah.
So we talked about when the right time to introduce your child is. So let's talk, and the frequency of the cleanings. Every 6 months is great. How does that help you as far as preventative care and just overall health?
Well, preventative care is the goal. Okay, I would be remiss if I didn't say about a third of my patients were not on a preventative basis, and often it's because they avoided preventative care. What you want to do with preventative care is you want to get in and you want to catch things prior to it becoming a symptomatic problem for you. We want to catch things before it becomes a toothache, before your gums get sensitive, and those things can sometimes only be detected if you're in our chair and we're able to take a few x-rays and get a close look. And that way we at least keep a close tabs on things like that. We can keep it from becoming a bigger problem.
And maybe not just with your teeth. I know dental health can also affect other areas of your health.
Absolutely. It's proven. It's proven, and it's science-backed that there's a direct correlation between oral health and a lot of systemic diseases. And for instance, diabetes. If you have diabetes, it's kind of a bidirectional relationship there, where diabetes makes it difficult for you to control your blood sugar, but then you get periodontal disease, but your periodontal disease can make it tougher for you to control your blood sugar. It also, periodontal disease is something that makes the efficacy of certain hypertension medications less efficacious. So it's things like that you want to get in and check out, especially if you have those situations. And so you want to prevent any major dental issues by coming in for preventive care.
Oral health, part of your overall
Right.
health scheme, for sure. Dr. Powell, thanks so much for answering our questions. And people hopefully will walk into your chair and be at ease and realize what an important part of their lives it is.
Yeah, absolutely. Thank you for having me.
Thanks, Dr. Powell. Thanks for being here for Valley Health Minutes. We'll see you next week.